Hello, welcome back to my channel RBMSQ Bank Knowledge Booster. Today I am going to discuss about important points to know about obstetric and gynecology, that is ONG. Today I am going to discuss about antenatal mother, when she has to do first visit, second visit, third visit and fourth visit. And also I am going to discuss about nullifera, gravida, P2+1 and much more. So before going to discuss about antenatal mother, let me talk about the fertilization. What do you mean by fertilization? Here fertilization is the process of fusion of the spermatozoa with a measure ovum. And almost always fertilization occurs in the ampullary part of the uterine tube. And the fertilizable lifespan of oocyte range from 12 to 24 hours and fertilizable lifespan of sperm is 48 to 72 hours. So you can see the diagram clearly. See the diagram closely. You will get to see that number 1. That number 1 is the secondary oocyte which is released from the ovary during ovulation. After that you can see this number 2. Number 2 is the secondary oocyte in tube. And number 3 is the fertilization. It is the part of ampulla, that is fallopian tubes. This part is known as ampulla where fertilization takes place. After fertilization you can see this number 4, it forms into zygote. Number 5 is the 2-cell stage. Number 6 is the 4-cell stage which occurs during 30 hours. And number 7 is the early morula. And number 8 is the late morula, and number 9 you can see that is early blastocyst stage with disappearance of zona pellucida, and number 10 is the early phase of implantation, and this implantation takes place on the uterine wall. Now let me talk about antenatal care. So here antenatal care means systematic supervision where included examination and advice of a woman during pregnancy is called antenatal care. Aims of antenatal care are to screen the high-risk cases, to prevent or to detect and treat at the earliest any complications. If we will do screening, then only we can detect the high-risk cases. That's why screening is very important. After knowing the high-risk cases, we can prevent it, we can treat it as early as possible. And objectives of antenatal care is to ensure a normal pregnancy with delivery of a healthy baby from a healthy mother. Now let me talk about elderly primigravida. It means a woman having her first pregnancy at the age of 30 or above is called elderly primigravida. But according to FIGO, that is International Federation of Gynecology and Obstetrics, the elderly primigravida age is 35 years. Extremes of age are risk factors. It may be teenage and elderly, both are at risk factors. Elderly married woman has high fecundity. High fecundity means high ability to produce offspring. A woman married late but conceived soon after. Teenage married woman has low fecundity. Woman married early but conceived long after marriage. So in both conditions there are complications during pregnancy. Complications like abortion, preeclampsia, abruptio of placenta, uterine fibroid, etc. And during labor, there is increased incidence of preterm labor, prolonged labor due to uterine inertia caused by anxiety or malposition. And fetal risks are preterm birth, IUGR, fetal congenital malformation. Here IUGR means intrauterine growth retardation. And during puerperium, there is increased morbidity due to operative interference. There is also failing lactation. So next, gravida. Gravida denotes a pregnant state both present and past. Here parity, it denotes a state of previous pregnancy beyond the period of viability. So gravida and para refers to pregnancies and not to babies. Now let me talk about primigravida and multifera. Here primigravida is one who is pregnant for the first time. The woman who become pregnant for the first time, that is known as primigravida, and multipara is the one who has completed 2 or more pregnancies to the stage of viability or more. Means if the woman becomes second time pregnant, that is known as multipara. And primipara, suppose a pregnant woman with a previous history of 2 abortions and 1 term delivery. This can be expressed as 4 gravida, or we can write G4. That means the woman become pregnant 4 times. In clinical practice, to summarize the past obstetric history by 2 digits, the first one relates with viable births and the second one relates with abortion, connected with a plus sign affixing the letter P. This we can write like this: P2 plus 1. That means the pregnant lady had 2 viable births and 1 abortion. Next, a nullipara. A nullipara is one who has never completed a pregnancy to the stage of viability. She may or may not have aborted previously. That is known as nullipara. And next is a parturient. A parturient is a woman in labor. The woman who is in labor, that is known as parturient. And nulligravida is one who is not now and never has been pregnant. The woman who is never been pregnant, that is known as nulligravida. And a parpera is a woman who has just given birth. The woman who has given childbirth just now, that is known as parpera. Now let me talk about LMP and EDD. LMP means last menstrual period. EDD means expected date of delivery. From the LMP, the expected date of delivery, that is EDD, has to be calculated. So calculation of EDD is done according to Nasel's formula by adding 9 calendar months and 7 days to the first day of the last normal, that is 28 days cycle menstrual period. For example, I have given one here, that is LMP. I have taken 09, means day is 9, month is 3. 03 means March. So the date is what? 9 March 2024. That is the LMP. So for EDD, what we have to do? According to the Nasel's formula, we have to add 9 calendar months and 7 days. I have add here 9 calendar months, that is 09, and 7 days, that is 7 on the line of days. So after calculating what I got the EDD, that is 16 December 2024. The expected date of delivery for the LMP 0903 2024 is 16 December 2024. After adding 7 days and 9 calendar month, I got this date. Okay. And now let me talk about antenatal visits. Generally, checkup is done at interval of 4 weeks up to 28 weeks, at interval of 2 weeks up to 36 weeks, and thereafter weekly till delivery. But as per WHO recommendation, the visit may be curtailed to at least 4 visits. These are: first visit around 16 weeks, second visit between 24 and 28 weeks, third visit at 32 weeks, and fourth visit at 36 weeks. We have to give 2 doses of tetanus toxoid to the mother so that we can protect both mother and baby. First dose between 16 and 24 weeks, and second dose at least 4 weeks after the first dose. And minor ailments during pregnancy which can occur. Okay, that means small problems which can occur during pregnancy are nausea and vomiting, backache, constipation, leg cramps, acidity and heartburn, varicose veins, hemorrhoids, etc. These are the problems which can occur during pregnancy. And now let me talk about biophysical examination. While doing ultrasonographic examination of the fetus in the early pregnancy can detect fetal anomalies. Early pregnancy means at 10 to 14 weeks. and chrome rump length, which is also known as CRL, smaller than the gestational age, is associated with the risk of chromosomal anomalies, which are trisomy or triploidy, and increased knuckle translucency, that is NT, at 10 to 14 weeks is associated with many chromosomal abnormalities. These are trisomy, monosomy, triploidy. And absence of nasal bone on USG, that is ultrasonography, at 10 to 12 weeks is associated with fetal Down syndrome. And triplet test is done between 15 weeks and 18 weeks. These triplet tests are MSAFP, that is maternal serum alpha fetoprotein, HCG, human chorionic gonadotropin, UE3, that is unconjugated estriol. So thank you for watching. Do subscribe my channel so that I will get motivation. Okay, thank you.